Can alcohol cause sleepwalking? If you've ever wondered whether drinking alcohol can lead to sleepwalking, you're not alone. This question has been a topic of interest for many, especially given the complex relationship between alcohol and sleep. To start, let's look at what sleepwalking, or somnambulism, is. It's a condition where people perform complex behaviors while they are still asleep, often without any memory of the event in the morning. Now, the question is whether alcohol can trigger this. Research has shown that there is no direct evidence that alcohol causes sleepwalking. Several studies have investigated the effects of alcohol on sleep, but none have found a clear link between alcohol consumption and the onset of sleepwalking or related disorders like confusional arousal. When you drink alcohol, it does affect your sleep, but not in a way that directly leads to sleepwalking. Alcohol can make you fall asleep faster, but it disrupts the quality of your sleep later in the night. It increases the amount of deep sleep, known as N3 sleep, in the first few hours, but reduces the amount of REM sleep, which is crucial for restful and refreshing sleep. Alcohol also affects your body's ability to regulate its sleep-wake cycle, or circadian rhythms. It can decrease melatonin secretion and alter your body's temperature rhythms, making it harder to maintain a normal sleep schedule. In cases where people have claimed that alcohol-induced sleepwalking was the reason for their actions, these claims have not been supported by scientific evidence. The legal defense of sleepwalking due to alcohol consumption is not backed by sleep medicine literature, and there are no sleep laboratory studies that show alcohol triggers sleepwalking in clinically diagnosed sleepwalkers. So to answer your question, while alcohol significantly impacts your sleep quality and architecture, there is no evidence to suggest that it directly causes sleepwalking. If you're concerned about sleepwalking or any other sleep-related issues, it's best to consult with a healthcare professional for personalized advice.